Hello, this is Dr. Shealy. These are very trying times as we move back into our workplaces. Each of us has questions about how to do it safely. I hope this presentation will help outline some of the guidelines used to safely bring employees back into the workplace. Let's divide recommendations into some categories, including screening, social distancing, hand hygiene, mask, and disinfection. These recommendations stem from studies done with influenza, as no studies have been done with COVID-19, but we believe that they will prove helpful in decreasing the spread of COVID-19. Employees should be screened as they present to work daily. They should be asked if they have any cold symptoms, including cough, sore throat, or congestion. Temperatures should also be checked, and if greater than 99.5, the employee should be asked to return home to be evaluated by a medical professional. If an employee feels sick, they should remain at home. Social distancing has been shown important to reduce the spread of viruses. In an epidemiological study, it was shown that social distancing alone produced a median reduction of 25% in cumulative influenza attack rates in the general population. Employees should be encouraged to avoid groups. We could also consider telecommunicating as opposed to face-to-face visits. It is important that if we're unable to social distance, perhaps other alternatives are available, such as mask, ventilations, and also staggered shifts. Remember that fit testing may be needed to ensure that a N95 mask adequately fits. Perhaps one of the most valuable lessons learned from this infection will be that we need to wash our hands. That alone will markedly decrease the spread of a virus. It is shown that if we wash our hands 11 times daily, reduces the occurrence of SARS in the 2003 pandemic. Hand washing is just as adequate as using hand sanitizers with 60% ethanol or 70% isopropanol alcohol. This can reduce the acute respiratory infection illness by as much as 16%. Frequent hand washing is a cornerstone to prevent the spread of virus. Masks will also help decrease the spread of the virus. Basic respiratory etiquette, such as coughing in your elbow or shirt, will markedly decrease the spread of the virus. We know that surgical or handmade masks reduce transmission from a sick person to a healthy person. Please remember that the mask should cover both your nose and your mouth. N95 masks, which are worn by healthcare professionals in a healthcare setting, work not only to prevent spread of our germs to the outside, but also filters the air that we breathe in, keeping the germs from the outside coming in. Our homemade masks work to keep our germs inside. They will help to decrease the spread of the virus. The COVID virus can remain viable on different surfaces for different lengths of time. We know that in air it is viable for 24 hours, on cardboard 3 hours, on stainless steel it is viable for 2 to 3 days, and on plastic over 3 days. There are some outliers, one of which is a cruise ship that was abandoned for 17 days. When it was entered, they found that 17 days later, the virus was still active. Frequent disinfection with plain soap and many disinfectants will eradicate the virus. It is important to wipe down areas such as the handrails, keyboards and desktops, light switches and doorknobs where we commonly touch. Deep cleaning of the work environment is very helpful. Here at MFP Work Wellness, we would like to help you return to a safe workforce. Working together, we can provide the safest environment into which employees may return to the active workforce. If we can help, please don't hesitate to call us at 803-286-5223 or email us at info@mfpworkwellness.com. Thank you.